NHS. There have been various estimates about the number of people in any country who may become infected over time. We aim to, as the Prime Minister himself has pointed out, flatten the curve, reduce the rate of reinfection in order to ensure that the NHS can be protected. And I think that many people will reflect on the fact that the Prime Minister succumbing to the virus is a reminder of how seriously we all need to take the advice that the NHS has been giving us. Simon.
Thank you. Yes, so on the question of London hospital beds, as of yesterday, the most recent figures, we had just under 3,000 empty and available hospital beds across London. And as you say, Beth, we are bringing on additional beds next week at the new NHS Nightingale Hospital. That is being configured initially to be able to look after up to 500 patients, but there is the physical capacity to potentially take that to up to 4,000 if it were required. So there is obviously an enormous effort going on, not just across London, but across the Midlands as well, where we're seeing continued growth in cases. And that's why, as well as freeing up the 33,000 hospital beds across our current English NHS hospitals, we are also taking these unprecedented steps to build in a few days hospitals that would normally take years.
Thank you very much. And we'll turn now to Andrew Woodcock from The Independent.
Mr Gove, there are large numbers of people all around the UK who are reliant on food distribution through food banks and other charitable efforts. These charities are still working, but many food banks have closed and donations are down. Many volunteers are over 70 and they've been advised to stay home. The Independent's launching a Help the Hungry appeal to support the London Food Alliance, but there's need right across the country. The government says it's supporting all sections of society through this crisis. So is there going to be financial and logistical support for these charities? Are any of the 700,000 people who volunteered to help the NHS being committed to this effort? And Sir Simon Stevens, could I ask, you've been head of the NHS since 2013. Do you regret the bed reductions and the failure to increase nurse training numbers during your tenure, which have left the NHS in a position where it entered this crisis with its critical care bed base amongst the worst in Europe, with Italy, for example, having twice as many ICU beds, and the UK having the lowest number of nurses and doctors per head amongst developed nations, according to the OECD? Isn't the lesson from this crisis that the NHS needs more capacity at all times if it's going to be ready to deal with this kind of surge in demand, and it can't be made to operate with no slack as it has been under your watch?
Andrew, thank you for those questions. On food and helping the vulnerable, let me say a few things. The first thing is I want to thank all those who work in food production and in our supermarkets for rising to the challenge of making sure that our shelves can be refilled and that people who need it are able to get the food that they need. Now, of course, we need more than simply to have an effective food production chain. We need to make sure that those most in need, those who are self-isolating, get the food and the other support that they need. That's why the NHS has identified up to 1.5 million people who are shielded, who've been advised to self-isolate for 12 weeks, and it's why government departments working together are ensuring that there will be food distributed direct to those individuals, with community pharmacies also providing the prescription medicines that they need. Now, there are people beyond that 1.5 million who are not self-isolating for 12 weeks, but who are vulnerable, people who in the past have used food banks, people whom we need to support now. And it is the case that the volunteer networks that have been set up across the country are ensuring that we can match volunteers who are willing to go shopping and to hand food to those vulnerable people who are staying at home or who may not themselves have the social networks to get the food that they need. And of course, the tremendous response to the Good Sam initiative that Matt Hancock announced earlier this week, with hundreds of thousands of people stepping up, is an amazing example of voluntarism in action and national solidarity. And we will be doing everything we can to support them. And my colleague Oliver Dowden at the Department of Culture, Media and Sport is looking at a specific fund in order to support charities in the work that they do. And we'll be saying more about this in the days to come. I also want to thank those people in the hospitality and catering sector who have stepped up and who are doing everything they can to support the vulnerable. John Vincent of Lyon is making sure that his stores remain open as takeaways in order to support the NHS. It's that sort of collaboration between citizens, the voluntary sector, backing from government, and enlightened business people that I think will help us to beat this virus. And I'm grateful to you for the opportunity to thank all those who are making that contribution. I'll now hand over to Simon.
Thank you. So the NHS does need more staff and it does need more hospital beds, and we've been saying that for some time, and that is what's going to be happening over the next 5 and the next 10 years. But the reality is that what I've described is that over the last several weeks, we have freed up the equivalent of 50 hospitals across England ready and waiting for coronavirus patients. Under normal circumstances, you would not keep 50 hospitals fully staffed with nurses and doctors not actually looking after patients, which is why no health service in the world, anywhere in Europe, anywhere internationally, would be able to withstand a coronavirus epidemic unless the sort of measures that the public are also involved with are also put into place. And that's why it's so important that the public support the work of our very pressurised frontline nurses, doctors, therapists and other staff across the NHS by staying at home and in so doing saving lives.
Thank you. And we'll turn now to Tim Ross from Bloomberg.
Thank you. Michael Gove, we were told before the decision was taken on Monday to impose much stricter rules on people's movements that that decision would be based rigorously on the data around footfall and public activity and transport. Yet, despite asking every day this week, the government has not so far provided any of that data to justify the most sweeping restrictions on the population the country has ever seen. Will you promise now to publish that data? And could you explain why it hasn't been published so far? To Sir Simon Stevens, can you guarantee that the NHS is ready for what's about to come? And if not, what is the one thing you still need from the government to prepare yourselves?
Thank you, Tim. On the data, at every stage, we have followed the scientific and medical advice that we've been given, and we believe that we've taken the right steps at the right times. And the evidence shows that since the measures that we took on Monday, the British public have responded in a fantastic way. And we've seen a dramatic decline in the use of public transport, allowing public transport to be increasing the preserve of key workers. We've seen a decline in footfall, and people are, the overwhelming majority of the British people are, following the strong advice that has been given in order to protect our NHS. And of course, we will share that data with you. One of the features of today's briefing was the set of numbers that I and Simon shared with you. And of course, we will share figures, share data in a spirit of transparency so that people can see that we are doing everything that we can. But I'll hand over to Simon, first of all, to answer your question on the additional help and support that we can give the NHS.
I honestly believe that everybody across the NHS is doing everything that can possibly be done to ensure that we're able to best look after patients who need our care during this coronavirus pandemic. One of the points that I think has been particularly remarkable actually over the last several weeks is the way not only the NHS but all public services have come together. That's true for local councils, that's true for care homes, it's true for the voluntary sector. And across government, we have had the support of the Ministry of Defence, we've had the support of other parts of government helping us prepare in different communities, because as Michael said a moment ago, we earlier this week wrote to up to 1.5 million people asking them to take special care given their background health conditions, and for them to be able to stay at home in that very self-contained way requires people who can help with shopping, who can help collect medicines from the pharmacy. That's an enormous team effort that the NHS by itself can't do, and we are getting that support.
I might just ask Jenny just to say a little bit about data, social distancing measures and the appropriateness of the steps that we take. Jenny.
Thank you. So I think, as we've said, we've been trying to be transparent with this, but very confident that at all stages the government has acted on the science. It is an unprecedented event, as I think we're all recognising, and there is some degree of uncertainty with this. So with some of the data, as you acquire the data and the steps go into place, actually your data changes. So the earlier conversation around when will the peak be, well, it depends how successful we are. So there is a bit of a moving agenda on some of the data, but absolutely clear that we have acted, we have looked at the modelling, we have taken those interventions in order, which we know will produce the biggest impact, and we have steadily implemented those. And the last ones, of course, in relation to strict social distancing, and particularly the shielding of very, very clinically vulnerable people, is an important step to time appropriately, not because, just least because of the risks of them with coronavirus, but because they have multi-morbidities, they have other problems, and they need a lot of social support. So in this country, we have timed them really carefully to ensure that those social support systems are around to maintain them through the period of isolation.
Thank you, Jenny. And I'll turn now to Hugo Guy from the I newspaper. Hugo.
Mr. Gove, it sounds like you and your cabinet colleagues are not going to be automatically tested for coronavirus, despite the fact that the Prime Minister and the Health Secretary have tested positive. Can you confirm that that's the case, that there's no plans to test all of you? And if so, explain exactly why. And can I ask, I think this is probably a question for Dr. Harries. We've heard a lot about the prospect of getting kits that can test for whether or not someone has ever had coronavirus. We're told that 3.5 million of those are on order. Can you clarify, have those kits already been manufactured? And if so, by whom have they been manufactured? What company is producing those? Thanks.
Well, thank you, Hugo. People are tested if they are symptomatic, and those members of the sort of central effort in helping to defeat the virus who do show symptoms are appropriately tested. But I think you can tell from the fact that the three of us are here demonstrates that there are three of us who have not yet demonstrated any symptoms. But it is important, in order, as we mentioned earlier, to try to ensure that we slow the spread of the virus, that everyone, wherever possible, practices the appropriate social distancing disciplines that we've announced earlier. I'll hand over to Jenny and also to Simon just for a final word as well. Jenny.
So actually I might just add to the points you've just made. So as I said earlier, we have very clear testing criteria. So we would not, in the early phase of the outbreak, we would have strong containment and contact tracing mechanisms. That is not appropriate at this point in the epidemic in the UK, but we will test appropriately for clinical management. The appropriate thing to do if you have symptoms is to self-isolate and remove yourself from the environment so you can't potentially transmit disease to anybody else. And that applies just as much to the cabinet members as it does to myself or any other part of the population. The only other criteria would be about the centrality of your role to COVID-19, and it's exactly why Simon has highlighted the importance of testing our workforce and other first responders as well, who are keeping the response going. In relation to the 3.5 million testing, the have you had it as opposed to the have you got it test, they are coming from a variety of different manufacturers, and I think, as Professor Whitty has said before, it is really critical that each of those ones is tested. We test the sensitivity and the specificity of the test, so how frequently we can pick up the disease, and then how sure we are that it's a true positive test. And each of the different types of those testing kits will be evaluated.
Thank you, Jenny. I'm going to leave the last word with Simon. Simon.
Well, I think it's simply to say that, unfortunately, pressure on the NHS is going to intensify over the coming weeks. There's no doubt about that, before things hopefully begin to improve. And so this is going to be a time when a lot of our frontline staff are going to be in highly stressful and pressurised circumstances. But I think what they would want me to say to the rest of the country is know this, that everybody is pulling out all of the stops to do the right thing. And if you can help too, by following the measures that have been set out, staying at home, you will save lives.
Thank you all very much. Thank you.